All right. I think I hear some feedback. I'm sorry about that. Uh, oh. Wait a second. If I turn that on. Let's try that. And it looks like there's something playing at my goodness. All right, let's try this. Let's see if that helps. Maybe that'll do the trick. All right, for those of you who are listening on the stream, wow, what a crazy color. That looks better. All right, let's do something. One of the things I did last week, I have been asked to repeat it because the volume was so low, it was very difficult to hear, and I trust the volume is just fine today on both the K-Talk and on the stream. And if someone would check in and oh, the news is playing. I am so sorry. All right. If you can let me know when that news plays out, then we'll go. You know, I'm supposed to be getting better at this numbers. Just amazing sometimes. All right. Is that it? Anyway, for those of you on the stream, and I appreciate your participating in that way, and I hope I am loud enough and coming through loud enough that can be heard. This topic is really important because we get complaints of this every week. There's not a week that goes by, seriously, that we don't have inquiries, questions. What can we do about cystitis and UTIs? And apparently the volume was low enough last time. All right, now let me stop that. We're going to restart here. All right. Good morning to K-Talk. All right, good morning to K-Talk. You're listening to the Jack Stockwell Radio Talk Show program this morning. And I think it looks like we're coming through okay. Still trying to, all right, there we go. All right, Paul, how's that sound? So I want to repeat what I was saying there a few moments ago to the stream. I did several minutes on UTIs and cystitis last week, and apparently the volume was so low that a lot of people just simply couldn't hear it. So I'm going to try and do it again today, I don't think to the same depth. But this is something that's really relatively easy to take care of. We have over 3 decades of practicing in Salt Lake City now. We have literally hundreds of women who have found relief from cystitis and from UTIs. 2 different things. And as I was talking about it last week, And the thing that kind of sponsored it or responded, not just because some patient inquiry on the subject, but because there was this article full of all of this medical nonsense. And it shows up every now and then in urology, gynecological publications, urology publications. A year can't go by without at least one article talking about this and some new drug. And the article was sponsored by the maker of the drug to some new way in order to achieve success in often repeated UTI infections, urinary tract infections. And so when I was reading this thing, it's even being quoted on internet self-help guides. And it discusses how gynecologists repeatedly treating a urinary tract infection with antibiotics may have missed the real diagnosis all along, which is cystitis. Now, the article discussed how women, for years and years and years, are diagnosed incorrectly from one doctor to another, believing that they simply are suffering from chronic UTIs. And they're trying, until they find the right drug, they won't know that they found the right diagnosis or the right problem. And it's then, this article describes the symptoms of cystitis and discusses how women get caught up in this landslide of one ineffectual treatment after another. And they get everything prescribed to them, even muscle relaxers, for Pete's sake, without ever really knowing what is wrong. And then the article goes into this nonsense that intimates that women need not worry about it because the problem all along has been established through the wrong diagnosis. I mean, once you get the right diagnosis of cystitis, somehow magically everything now is going to be just fine. It's going to be okay. All right, we finally found the problem. You don't have chronic UTIs. You have cystitis, and which is a far stretch since they state that no medical person knows. The article says it. No medical person knows what causes cystitis, or why it puts women at increased risk. Now, the medical good news is that once the condition is diagnosed, treatments can help, and that is the world in which modern medicine works. The 3Ds. We have to get a diagnosis. Now we have a disease. So now we can have a drug. And if we don't follow that protocol, then we can't help you, but I'm sorry, nobody else can help you, is what they say. As though cystitis and UTIs have only started to be experienced by women since these drugs were available. Prior to that, it was something else. Let alone all of the nutrition manuals and books and anthologies that were written prior to World War II that talks about even the effectiveness of apple cider vinegar, diluted apple cider vinegar taken orally. Now, the medical good news is that once the condition is diagnosed, there are treatments that can help, since medicine has no idea what causes it. All treatments, of course, like in a lot of different diseases where there's mystery as to what's causing the problem, at least they can treat the symptoms, which is primarily what medicine is oriented for. So anti-inflammatory drugs, which destroy the stomach, antihistamines, which can dry you up like the Sahara sand. But if these things don't help, don't worry, because there's a lot more potent medications like anticholinergics that work directly on the nerves and your ability to sense an infection. And of course, if the drugs don't work, well, then there's always surgery. And one of the new disastrous medical Band-Aid adventures into the bladder is to treat interstitial cystitis infusing a tuberculosis vaccine into the bladder in an effort to stimulate new cell growth. I mean, just thinking about that has to cause some severe pain. And physicians don't think twice about using some very powerful narcotics or injecting heparin or DMSO directly into the bladder. So another new medical treatment, a drug called RTX, actually that's been around a while, actually deadens the nerves in the bladder. It's just like ablation therapy and RA therapy on low back pain. You know, just turn off that warning light on your dashboard and just hope and pray that the oil will take care of itself, but get rid of the warning light. Pain, obviously, is an indication something is wrong. There's dull, achy pain, and then there's sharp pain and various kinds of pain in between. Sharp pain is when tissue is being destroyed or it's about to be destroyed. Achy pain, even hard, sore, achy pain, usually is a result of ongoing inflammation. And there's a difference between the two, obviously. Now, the word from the trusted medical authorities, and I know this because this is what my female patients tell me that their medical doctor told them, is that, you know, you should check your, once you got the diagnosis, stop all your ineffectual treatments, which means, you know, this drug isn't working, we're going to try another one. If you suffer from cystitis, we're going to have to move you to more powerful drugs with lots of side effects that probably will be just as ineffective. And naturally, there's always surgery. So how do you get started? Well, most of the ladies that I talk to who've had this problem have already been to a urologist, or they've been to a urogynecologist, or they've been to their gynecologist. And a person who specializes in the treatment of cystitis is a urogynecologist. And a condition that the entire profession admits we have no knowledge of what causes it, but we know how to mitigate the symptoms to some degree. So the cause of the condition, you know, what is really going on here? What causes this? And we've known this for some time. This isn't some new discovery coming out of the Mayo or the Cleveland Clinic. They've known for some time that the cause of this condition is a weakened set of cells that line the urinary tract. All the little tubules in the body, the ureters coming from the kidneys to the bladder, the urethra coming from the bladder to the external orifice, blood vessels, some of the vessels that carry lymphatic fluids, the thoracic duct. All these things are made up of cells, and cells upon cells. And even the smallest of capillaries is one cell thick, that just one cell after another cell that wraps around itself and creates a lumen, a hole. And then one cell after another lines up doing this till you form a tube. And then there's an inner lining to those vessels, an outer lining to maintain elasticity and strength, and an inner lining to maintain smoothness, which interestingly enough, food-based chromium has an awful lot to do with making the inner linings of your arterial bloodstream slick as ice. But that's for another show. And so what we do know is that cystitis comes from a failure of these cells that line the urethra, which is, the weakness is simply caused by nutritional deficiency, like most diseases in the body. And it's made worse by drugs, both prescriptive and over-the-counter, that are dealing with symptoms. And that's it. That's all there is to it. And without an understanding of this fact, and with increasing use of drugs, It's very easy to see the folly of medical intervention, even by urogynecologists. Now, if ever there were a condition that described the state of standard medical care, it would be chronic cystitis. Because while getting completely caught up in the science, we throw more and more powerful drugs at women. And in the end, when it comes to cystitis, remember what I've said about, and others have said about doctors for some time and their drugs. A drug is something about which doctors know little, given for a disease about which they know even less, into the body about which they know almost nothing. I've often referred to this article that showed up in March of 2003 in the New York Sunday magazine. It's inside the New York Times. What's her name? Lisa Sanders, Dr. Lisa Sanders. She used to show up on television programs all the time when they were looking for a medical expert that could talk about whatever is current in the news in street language so that their audience could understand what's taking place. And she talked about the white coat ceremony when she was a freshman at NYU's medical school. And she said the dean of the medical school addressed all of the incoming brand new freshman students dressed in their new white coats for the beginning of their medical education. And he said to them, and she has a beautiful article on this, he said, "Doctors, half of what we are about to teach you is wrong. Unfortunately, we don't know which half." And she said he was dead serious. So let's go on here. No more drivel, no more nonsense. Here's what you do. First of all, we know that it's not caused by E. coli. If it was caused by E. coli, antibiotics would cure it quickly. When bacteria are present and antibiotics are used alone, a portion of the bugs become immune. The stronger bugs, and we know this, one of the downfalls of antibiotic therapy is you kill off the weak ones and the stronger ones get stronger, burrow deeper into the tissue to get away from the antibiotic effect, actually creating the condition of interstitial cystitis. Not just cystitis on the lining now, it's interstitial, inside deeper into the tissues, where it becomes an even more difficult condition to treat. And that is why for some people, some women, one single UTI can result in chronic cystitis for years or even for the rest of their life. And in case you didn't get that, the medical treatment can be the cause of a lifetime of misery because of all the side effects. So rather, what you have to do is to treat the underlying cause of the problem by bolstering the strength of the columnar cells that line the urinary tract. These are unique cells because they allow for bacterial or microbial attack against them. They're called columnar cells because they look like a column, and they line the urinary tract. And as I said, their job is to attract bacteria, to attract microbes. And then the interesting thing happens because under this attack, these cells actually die off by the millions, sloughing off and carrying away the infection with them. And the process is interfered with when antibiotics are used, allowing the bacteria to mutate or to burrow even deeper into the tissue. I mean, it can be seen on a microscope. So once past the barrier, these columnar cells lining the tract, the problem becomes more difficult to treat and to cure. Nonetheless, the treatment remains the same given the correct pH of the urine and improved diet with correct supplements. Women can actually care for themselves of chronic and interstitial cystitis. What a concept. Put the body into a condition where it can cure itself. Now, the correct pH, it's acidic. Your urine is acidic. Why? Because it's getting rid of uric acid and other things, that minerals that the body doesn't want, and other kinds of things that are water soluble, that are a part of the detoxification system through the kidneys, that ends up in the urine, but it stays acidic because there are minerals in there. What happens to minerals in solution when they're in an alkaline pH? Yeah, they precipitate out and become a solid. We don't want that in the urinary tract. We don't want that in the bloodstream either. So it needs to stay in solution, and it keeps the bacterial population down, because bacteria cannot exist in an acid environment. All you have to do is accidentally drop a tiny little speck of acid on your skin, working in a chemical situation or whatever, and you will know why bacteria cannot exist in an acid environment. It simply gets dissolved. So, with the correct pH, and you can get pH sticks in the drugstore. You can get the little reagent sticks for different kinds of problems in the body. But one of the most common one is, acid alkaline. You can use the same reagent stick in your mouth to measure the pH of your saliva, which should be slightly alkaline. The stomach's a little too far away to use these little indicators. But you can do use these little markers with your urine, either sitting or standing, it doesn't matter. And you just, when the urine is flowing, you stick the little indicator strip into the flow of urine, and right away you'll have an immediate indication as to the pH of the urine. Urine should be anywhere from about 4.5 to 6.5. If it gets above 6.5, you're going to have stones, because the urine will start precipitating out minerals, especially calcium oxalate, of which most kidney stones are made of. Keeping the urine acidic prevents stones. It also prevents a bacteria buildup, which is why for a lot of ladies who complain of, I've got another UTI, it may not be a UTI. It may be nothing more than alkaline urine that is stinging the wall of the bladder, causing itching and pain and making you think that you have another infection. Now, when I said hundreds of ladies at the beginning of this, I'm referring to the hundreds of women who now carry in their purse or bag a little bottle of Cal Ammo. It's probably the least expensive product made by Standard Process. CALAMO. At first indication that something is wrong down there, where there's some stinging or itching or anything else, you take about 6 of these. They're extremely salty. You don't want them hanging around in your mouth. Calcium ammonium chloride is the basis of the acidic nature of our oceans on this planet. Now, ocean water is slightly alkaline. It's not acidic, it's slightly alkaline, but the thing that keeps the ocean water from getting too alkaline, where there won't be any transfer of oxygen into the atmosphere from the vegetation growing in the oxygen, is a slightly acidic buffer that keeps the ocean water from getting too alkaline. And that comes from a combination of calcium and ammonium chloride in a dissolved state that makes life on this planet possible. CalAmmo is simply that salt, calcium ammonium chloride. You take about 6 of them, shoot them down with plenty of water, Try to get them down as fast as you can, because I said they're saltier than salt. Not a particularly enjoyable experience. However, it's a lot better than bile salts. And usually within 15 to 20 minutes, you'll feel relief. Now, that doesn't cure cystitis. It just changes the pH of the urine if it slightly goes alkaline. Now, these columnar cells, as long as they're healthy, will continue to catch the microbes that come by that want to burrow into the tissue because they want to live. And they're going to have a hard time living in the toilet water after you urinate. So they look for a food source, which is the walls of your urethra and into the tissues behind that. The columnar cells grab a hold of them. They die in the way of doing that, sloughing off, carrying the bugs out of your body with your urine. Now, the treatment remains the same, as I said, given the correct pH and the improved die-off that these supplements will help support. I'll get to them in a minute. But women can actually cure themselves. I'm not curing anything. In fact, nobody cures anything. It's the body that cures itself. You know, emergency rooms save lives by the hundreds every day in this country, but they don't cure anything. They save a life. But then the body goes on after that, if your life is saved, to cure itself. And it just needs a little bit of attention in the right area, in the sense of proper foods, to give itself a way back from the malnutritive state that allowed the disease process to occur in the first place. And when it comes to urinary pH, medicine manages to muddle even that up with the trainloads of antacids that are recommended to women. And it's just crazy. I mean, the Tums, the Nexium, the Pepsid, pop like candy, and acids are highly dangerous because they have a systemic effect. They affect every cell in the body, not just the elimination of acid in the stomach. And acids interfere with the excretion of acids and bicarbonates, causing the urine to become more alkaline. So when I have somebody, a lady, complaining that, I use that Cal-Ammo, and it really helps, thank you, Dr. Jack, but I have to use it every month. Well, now the next question is what is causing the constant swing of the pH back to alkaline condition? And that's what I asked him. Are you on antacids? Are you on PPIs? Do you have GERD? Acid indigestion? Because those drugs are causing your urine to be alkaline. So we've got another problem we have to take care of, and that's acid indigestion, but that's for another story. But an alkaline urine is the breeding ground for more bacteria. Anybody who's had microbiology 101 on a college level, maybe even in high school, some high schools, knows that part of your studying bacteria, and we did it in Bacteriology 101, you go around with your little Petri dishes, and you get your little swab, and you swab the surface of a public drinking fountain. And you put it in the little Petri dish and close it up. Or you'll swab a toilet seat in the public bathroom, or the handrail going up the stairs, wherever there's a lot of human contact. And you swab it with your swab, you put it in the medium that's inside the Petri dish, and you close it up, and you take it back to the lab, and you put it in the little warmer. And do you know what that medium is made of that you're growing the bacteria in? A very alkaline solution. Because if it was acidic, the bacteria would be destroyed on contact. Just like any bacteria that's in your food at some big public luncheon that's got mayonnaise in it, and it's been out in the warmer air for a while, and bacteria begins to grow, and if you've got strong stomach acid, when you eat that food, you have nothing to worry about, because your stomach acid will destroy that bacteria on contact. So when you have a big, here I'm running out in the woods or weeds again. If you have some big celebration, maybe it's the dinner or the luncheon or whatever served after a funeral, or the banquet type of celebration at a wedding or whatever else, and there's a lot of these different kinds of foods, and 3 or 4 people suffer what they would want to call food poisoning because it feels like it, but all the rest of the people who ate that food get nothing. I'll bet you anything those people that got sick after eating that food have very weak stomach acid, and so the bacteria got into the gut and proliferated. Now, women who are taking Tums, Rolaids, Prevacid, Nexium, are the very same ones with most of the cases of cystitis. Older women, and if this is you, the first step in curing chronic cystitis is to normalize the digestion and toss your antacids. This is almost always possible. And for many, it simply requires a diet that follows proper food combining and the elimination of wheat and the addition of a product called Zypan. And if you've been listening to my health show long enough, you've heard me mention Zypan many times. Anytime I travel, I got a bottle of Zypan in my travel bag. And because, like in 2 weeks. 2 weeks from today, I will be in Minneapolis teaching 2 classes at a rather big seminar on what I do, and to 100 or more doctors. And I, because I might eat something on the plane, which is not necessarily the healthiest food, I will already have taken a couple of Zypan before I get on the plane. And when I eat at the hotel for breakfast, lunch, or dinner for the next 3 days, I will have my Zypan there with me because I'll take Zypan with every meal. It seriously acidifies the stomach contents, which is really the cause of indigestion. Your indigestion isn't from too much acid, which some doctor who skipped class on the day that they taught acid indigestion believes that you're having acid indigestion because you have too much acid. So we're going to stop the body's ability to make acid. And they call me the quack. And no, it's because you don't have enough acid. That stuff sits there in your stomach and ferments and forms gas and blows these unnatural acids that have formed in the stomach up the esophagus. Anyway, that's one of the first things I do with someone who has chronic cystitis. Number 1, Cal-Ammo. You're going to take 6 of them right off as soon as you open that bottle. And then you're going to take a couple of them every 4 to 6 hours. It acidifies the urine better than apple cider vinegar does. Now, apple cider vinegar will do the same thing on a shorter period of time. You have to keep taking it. Cal-Ammo hangs around a lot longer. And apple cider vinegar also has the advantage of enzymes and minerals and other things that are present that the Cal-Ammo doesn't have, but the Cal-Ammo works so fast with no side effects. And then also you're going to have Zypan. You're going to start using Zypan with your meals. Now, once you've gotten the antacids out of your system, it's simply a matter of rebuilding the protective urinary tract cells. We're going to rebuild those columnar cells that line the urinary tract so that they're healthy once again and they can do their job. This requires real whole food vitamins A and C, not beta carotene, not ascorbic acid. It requires the real McCoy. Vitamin A is only found in animal products. You do not find vitamin A outside of animal products in the rest of nature. You find some precursors to vitamin A, such as carotenes. We always think of carrots for the eye, but it's not vitamin A that's in that carrot. There are carotenes. There's about 60 different kinds of carotenes. Beta carotene is the one you hear about all the time. And it is in a healthy gut, which you don't find very often, that beta carotene will be converted into true whole food vitamin A. And then whole food vitamin C, which is a complex. It's a complex built around tyrosinase. You're not going to have tyrosinase present in ascorbic acid, which is why ascorbic acid will not cure scurvy. Whole food vitamin C will. Fresh, raw lime juice, fresh, raw lemon juice will cure scurvy, but ascorbic acid won't. Now, nothing you can get in the store, nothing you can get on the internet is going to get the job done like the stuff I'm telling you. Unless you're willing to eat whole buckwheat plants, whole alfalfa salads, raw bones, raw kidney, raw carrot oils, you're going to need to use some supplements that do this for you instead, where these whole foods have been condensed into pills. The job can take anywhere from 3 to 12 months of rebuilding the urinary tract, but it can happen. And for the average run-of-the-mill case of cystitis, you're going to need the following products from Standard Process. I will slow down for a moment while you write these things down. This is really important. AC carbamide. That's vitamin A, vitamin C, plus carbamide, which was always used by doctors and nutritionists and naturopaths and whatever different kinds of doctors before the discovery of Lasix, that helps to get extra fluid out of the body. Anybody that was carrying around too much water would be put on a dose of carbamide. It's derived from plants. And it's just pure urea. You need urea. You don't need uric acid. That's what your urine is getting rid of, but you need urea because it has an awful lot to do with your body's osmotic pressure with fluids and your body's ability for the kidneys to get rid of any fluid it doesn't want. Then you're going to take Cataplex AC. It's a complex of different foods concentrating vitamins A and C. 6 a day of these. 2, 2, and 2 throughout the day. Then you're going to take Arginex, which is a name for arginase. The FDA would not allow Standard Process to call their Arginex arginase. Arginase is an enzyme that breaks down arginine. And arginine, because of improper food mixing and combinations, and other kinds of problems, will cause an excess of arginine in the blood. Your body will get rid of it through the kidney, but it has a tendency to build up in the kidney, in what's called the renal pelvis, which can cause problems with normal kidney function. Arginex, that Standard Process had to call arginase. They called it Arginex because the FDA would not allow them to call it arginase, because then it looks like you're treating something. Well, I'm not treating anything. Standard Process doesn't treat anything. I'm just telling you what you can give your body so your body can treat itself. So Arginex, also 6 a day. 2, 2, and 2. Morning, noon, and night. With food is fine. An Alboplex, which is a complex to provide a very healthy kidney. 6 a day of those. And you take these in 3 divided doses, and if you already are taking antibiotics for a current infection, you might want to include Lactens. Lactenz, Lactens, about 6 a day. And you're going to do this you'll take the Lactens for about 30 days to offset the effect of any kind of a yeast infection that's brought on by the overuse of the antibiotics. In serious which happens rare, but when it does, I suggest kind of a shock treatment where you take a much higher dose of all these things for a short period of time. But this will often stop an infection from really taking hold and stems the pain and the burning and the shortening and the duration of the infection. Often this can stop an infection in as little as 24 hours. During this time, it's important to normalize digestion, stop taking those acid prevention sopper drugs. Also, you got to drink a lot of pure water, not distilled water, not RO water, pure water that comes from a spring or from the well. Clean well water is actually the healthiest water on the planet. Why? Because all the antigens that are floating around in the air, all the viral elements, all the bacterial elements floating around in the air have a way of falling down that well into the water. And it's in a diluted condition that gets into your system where it greatly improves your immunity to all the local factors that are causing problems. Sometimes people with severe allergies, seasonal allergies, if they would just drink well water, they can see within a week a tremendous decrease in their allergic reactions and the buildup of histamine in the system. So, cranberry juice, yes, it's okay. It's just fine. If in the beginning you're prone to repeated infections, it's okay, I guess, to use some antibiotics along with this protocol till you get those repeated infections taken care of. And then you continue the protocol that gets rid of the reason for the continued infections. Once this happens, you're probably near the end of your problem. And it's ironic that it seems to take years to understand something that seems so common sense. Despite expert medical information, like again, Cleveland Clinic or Mayo Clinic or Johns Hopkins School of health, some kind of health, I forget what it is. But infections will become less and less. What I've always said about bugs burrowing deeper into the tissues, especially when you become dependent upon antibiotics. What I said about not looking so much toward the bug, but rather towards the environment in which the bug is thriving is true. And antibiotics and drugs can be miraculous when you really need them. But despite well-meaning physicians, it's easy to see how hundreds of thousands of antibiotic prescriptions are given improperly every year. And then there are tens of millions of antacid prescriptions for women, which is also, in my opinion, an abomination. The very fact that women get one infection after another is just living proof of my philosophy and therapies as to what I'm talking about. As soon as you understand you really can't fool Mother Nature for very long, you'll be on the road to complete recovery. Or there are always the expert medical sites that suggest you need special attention, special treatment if you've been diagnosed with a urinary tract infection that repeatedly fails to respond to antibiotics. And if you're plagued with continued bouts of UTI symptoms, or if you experience symptoms of a UTI but the urine test fails to reveal any bacteria, you might, according to modern medicine, need to see a urogynecologist who specializes in cystitis. And there you can get all the antibiotics and all the tranquilizers and all the muscle relaxers and all the painkillers and all the anti-inflammatories and the antihistamines and the anticholinergics or surgery, none of which is going to have any supportive effect on the underlying weakness in the cell structure. you can address these chronic alkaline urine problems with what I've been talking about. Again, I want to repeat, first thing and sometimes all you have to do is CalAmmo, calcium ammonium chloride. As soon as you open the bottle, you take 6 of them. I've had so many women, after I've done a show like this, or they've heard from their friends, they come into the clinic, do you have calcium ammonium chloride? Well, we know right away what the problem is, asking a question like that. And we talk to them about it for a minute. And yeah, here's a bottle, and they go open it, and I say, make sure that little cup of water's full, because you're going to want to wash these things down fast. Usually within 15 to 20 minutes, they can feel a big change in the area of their bladder and the urethra. All right. I think that's mostly what I wanted to talk about as far as cystitis. I went way overboard, but I'm doing it because it was missed. The volume was set too low in last week's show. Now, and I was talking about improving your food choices, food mix. One of the first things that has to go with most kinds of chronic irritating problems, like that cough you can't get rid of, the headache that never ever goes away despite what you do, the cystitis, the urinary cystitis, or anal pruritus, just constant rectal and anal itching. First thing's got to go is wheat. And anybody who is studying wheat today knows, and I say this to the LDS audience, Section 86 of the Doctrine and Covenants talks about wheat for man. Well, in 1836, Kirtland, Ohio, that may be the case. That is not the case today, because the wheat that's in the marketplace today is not the wheat of your great-great-great-grandparents. Not by a long shot. Can you get that wheat? Yeah, it's out there. You can get the heritage wheat. You can get wheat that's real wheat. And what would you do with it? Well, you can make bread out of it. And that's the only bread that's healthy as far as I'm concerned, that's, because it's got wheat in it. It's not white bread. It's wheat. And you make sure you make bread out of it within a week. You don't grind up a bunch of flour and stick it in a can or a bag somewhere for manufacturing of bread down the road. Because the vitamin E content that's in the germ, once it's exposed by grinding, will go rancid. And rancid vitamin E oil is known to be a carcinogen. But any other kind of wheat, you notice that the revelation didn't say bread is for man. It said wheat. There's a difference between wheat and bread. All right, I just had to say that. Now, in conjunction with the idea of better food choices, because the more, and this again is to the ladies, who suffer from UTIs and interstitial cystitis much more than men. Food combination and getting away from processed foods, overly processed foods, pasteurized dairy, all these things become breeding grounds for more bacterial problems, especially inside the body. Now, one diet that I've suggested to ladies to go along with the use of the supplements that I recommended for cystitis and interstitial cystitis and UTIs is a ketogenic oriented diet where you have low fat or high fat and low carbohydrates. That is such a powerful diet. There are journals now being printed that have peer-reviewed research in these journals showing all of the benefits of the body from a ketogenic diet, including significant decreases in depression symptoms. Now, there was this pilot study that was done just recently. It's published in the journal Translational Psychiatry, suggesting that a well-formulated ketogenic diet followed for at least 10 weeks is associated with a significant reduction in depression symptoms among a small group of college students. It was a pilot study, it wasn't a major study. And again, it was published in Translational Psychiatry. And the research has documented notable improvements in the participants' overall well-being and their performance on several cognitive tests. Now, the research was prompted by the rising prevalence of major depression, particularly on college campuses. And the existing treatments, such as psychotherapy and medication, are effective, but many do not help everyone and can come with a lot of unwanted side effects, not the least of which is suicidal ideation. So researchers that were led by a Dr. Drew Decker at The Ohio State University, looking to explore a different approach, one that addresses the potential link between metabolic health and depression. Imagine that. Imagine someone thinking that what we eat and what we don't eat might actually have a negative effect on the human body. If eating the right foods, and I use the term right loosely here, can make somebody feel better, is it possible that not eating those foods could lead to somebody not feeling better? Now, the research was prompted, as I said, by this increasing level of depression on college campuses, and a growing body of evidence suggests that insulin resistance and excess body fat will produce an increased risk of depression, possibly through inflammatory pathways. So they hypothesized that a dietary intervention known to improve metabolic health, the very low carbohydrate ketogenic diet. Ketogenic simply means that it generates ketones, might serve as a beneficial therapy for students already receiving treatment for depression. So it was designed as a single-arm prospective trial, meaning that all participants received the same dietary intervention without a comparison control group. And the researchers recruited students from Ohio State who had been formerly diagnosed with major depressive disorder and were currently engaged in counseling or taking medication for their condition. And after an extensive screening to confirm eligibility and to rule out conditions like eating disorders that might skew the numbers, 24 students began the study, with 16 completing the full 10 to 12-week intervention. Now, I'm quoting from the study. One of the things we really wanted to make sure of is that we were providing a treatment for people who met the diagnostic criteria for having major depressive disorder. Each participant had about a 2.5-hour interview at the beginning and then weekly assessments of their symptoms. Now, before starting the diet, each participant, I'm reading from the study, received a detailed educational session. The well-formulated ketogenic diet required them to limit carbohydrate intake to less than 50 grams per day. They were to consume a moderate amount of protein and get the rest of their calories from fat, with an emphasis on whole food sources like olive oil, nuts, and fatty fish. And to help with adherence and offset the costs, the research team provided some staple ketogenic foods and ongoing support from dietitians through a secure messaging application. Now, continuing to quote, it was very important to make sure participants knew what they were getting themselves into. And a big part of increasing chances for adherence to the diet was talking to each individual about what they like and didn't like, so we could tailor some suggestions for how they could structure their diet. Throughout the study, the researchers tracked several outcomes. Participants self-reported their depressive symptoms biweekly using the Patient Health Questionnaire 9. Qualified clinician also rated their depression at the start, and it just goes on and on, measuring their morning ketone, glucose levels, assessing the body composition using scans and blood samples. The results showed a robust and sustained decrease in depression symptoms. Among the 16 students who completed the study, self-reported depression scores dropped by an average of 69% from the beginning to the end of the intervention. Clinician-rated scores showed a similar 71% reduction. Every participant who completed the study showed an improvement in the depression scores, and by the end, no one met the criteria for moderate or severe depression. Not even moderate. So what's this mean? The brain needs fat. You have, when you are involved in clinical work, like we are in our clinic, and you start dealing with a new patient that heard from somebody who was very happy with the outcomes of the work that we did in our clinic. And I have to tell you about a young lady, an 11-year-old I took care of yesterday with moderate to severe dyspraxia. Just massive clumsiness. Anytime we can get more fat into the diet, good healthy fats, just the brain turns back on in a matter of weeks. So as we're going out here before the next show begins, this young lady, severe dyspraxia, just very, dyspraxia is clumsiness. And not being, almost looking like you're drunk at 11 years old. Can't walk a straight line. Can't stand up straight. Waddles back and forth. No history of any kind of trauma in her life. A sixth grade student that is excels scholastically. She just looks like she's drunk. So, as usual, we've been everywhere. We've done everything. We thought we'd see, Dr. Jack, if there's anything you could do. And I'm sitting there thinking, why don't you come to me first? Anyway, I took some pictures. I could see the misalignment. I worked on her. Immediately, she stood up straight and started walking 90% better. Her father was more shocked at what was going on than the child was. And so we found out there was a trauma that happened in the first year of life. But I'll probably see her a couple of more times, but she was absolutely thrilled. She wasn't going to look goofy in front of her friends when she left the clinic. All right, to order any of that stuff I was talking about earlier, you can get it at forbiddendoctor.com, but also to schedule a consultation, see what I can do for you structurally, 801-523-1890. Now, I've got another hour on the program with some very good information for you. A lot of it on the latest stuff regarding the deleterious effects of the COVID vaccine that still is only starting to show up. And I think you should know about it because I know some people are lining up to go get the COVID vaccine along with their flu vaccine in drugstores and everywhere where a prescription is not even required. So I don't see the news playing. And Paul, I don't know. We can't turn the news off. So I think I will get into that now. But anyway, this young lady, the look on her face of hope and relief. I wish somebody had done that for me when I was 11. But my parents, like your parents, were doing the best job that they could with what they knew. But when I was a child, the therapy that I offer in my clinic didn't exist the way that it does now. All right. I hope that helps. I know I went on too long with UTIs and interstitial cystitis. But from the complaints that I get from ladies, outside of their weight gain and outside of, what's the other major thing that seems to bother them? Lack of energy, things like this. Right in the middle of all of that is a nice, healthy dose of UTIs and interstitial cystitis. All right, I've got some other things that I want to talk about. You all know, of course, of Dr. Sukarit Bhakti, and where just a world-renowned immunologist is sounding the alarm to the public that COVID mRNA vaccines have unleashed a worldwide wave of systemic vasculitis that has altered the brains of billions of people who have received the injections. Altered the brains. Now, vasculitis is just an irritation of the lining of the vascular system. Both arteries, veins, things that are involved with lymphatic transfer throughout the body, and I mentioned the thoracic duct earlier, that drains the lymphatic tissue, or drains the lymphatic fluids from the breast and from the lungs, which is why the number one metastatic site of breast cancer is the lung, because they have common drainage. But those little tubules can get very infected, very inflamed. And as a result, you can have multi-organ inflammation taking place. Now, Dr. Bhakti, and I am quoting here from one of his studies, it's published in Slay News, S-L-A-Y News. You can read it for yourself with the date of 15 September last month. He is warning that the mRNA shots have triggered this deadly condition to surge among the COVID vaxxed, and it's now damaging brains and hearts and other organs on a mass scale. Now, a year ago, what we were talking about and concentrating on was usually the inflammation and the damage that came from myocarditis, damaging of heart muscle from the microclotting that goes on from the presence of these vaccines. And what Bhakti is contending is that these shots trigger immune activation on the endothelium across the brain, the heart, the liver, and beyond, inside these vessel walls. And the endothelium is just that thin cell layer lining blood vessels. Now, I was discussing this at the beginning of this morning's show. I was talking about vasculitis in the sense that where these blood vessels come, your body makes these blood vessels. How does your body make a long tube of arteries? They're just little cells wrapped over on themselves, and the next one wraps over on itself, and the next one wraps over on itself, so that when you get down to the small capillaries, they're just one cell thick. Now, larger arteries, larger veins that are designed to carry more fluid are many hundreds, if not thousands of cells thick. But it's the same basic process. And the inner lining is how the vessel begins to develop. Then there are outer linings and outer and outer and outer till you end up with a very strong tube that can handle blood pressure coming out of the heart. Till you get down to the capillary size where there's very little blood pressure at all. In fact, it's very negative in some places. How does the blood flow if there's a negative pressure? That's a story for another day. Does the heart actually pump blood through 60,000 miles of arteries and capillaries? That's more than twice around the earth at the equator, is the distance of blood vessels in your body. Does the heart, that little 4, 5, 6 ounce organ, actually pump blood all throughout the body? Or does it just pump blood into and out of the lungs and into the coronary artery and the aorta to make sure the brain gets it under pressure? Or is some other action taking place deep in capillary beds that keep the blood moving? Aha. It's a subject for another show. Fascinating subject, mind you. Just wanted to tease you. So, Dr. Bhakti is saying that those who got the COVID injection, by the billions, he says, are suffering problems in their brain, their heart, their liver, and beyond. He claims that this vascular injury destroys neurons and it produces a silent, widespread neurological decline in cognizance, in memory. He further claims that the result is a population-level shift in cognition and behavior, diminished clarity, reduced willpower, and a blunting of natural intellect that leaves people less able to push back against medical coercion and overreach. Wow. Talk about a marketing program. If you were trying to sell a product for the world, and after a while, people just, not necessarily through suspicion, but just lack of interest in your product, stop buying it, and you had something you could give them that took away their willpower to resist your marketing, think what you could do with that. You follow me on where I'm going with this? And this is what Dr. Bhakti says, that those who got this shot have reduced willpower and a blunting of natural intellect that makes them less able to push back against medical coercion. What kind of medical coercion? Well, get your boosters. You've had one shot, now get your booster. The one shot isn't effective. We learned that for more than 2 or 3 months, so you got to get a booster. You need to get about 3 or 4 boosters a year. And there are those who hear that stuff and they run the other direction for their life. There's some people who hear that stuff and they don't have the willpower to resist it. Bhakti raised the alarm during a video interview, warning that the problem is so severe that there are billions of people whose brains have been destroyed by the COVID shots. He is an award-winning former professor of microbiology, and he says people have been permanently altered by these experimental injections. So, he said this: the mRNA vaccines cause the destruction of brain cells. He said, obviously, and that is what we are now experiencing. We are seeing, and I'm afraid to say, billions of people whose brains are not working anymore, not as they should be, at least. They are altered, he says, and they don't have the willpower anymore, and they don't have the intelligence anymore. Now, this is some pretty serious stuff. I mean, this is crazy. And it continues. And the state of Utah continues allowing this shot to take place because it's safe and effective. How do you define it? Now, you think effective means And I don't want to put words in your mouth, but you think effective means that it'll prevent you from getting COVID. COVID actually disappeared about 5 years ago. It was pretty well over with. But because it scared so many people, it's still the watchword for cold and flu season, as we're moving into cold and flu season. And safe and effective. Effective in doing what Dr. Bhakti says that it's doing. He says he proposes he points to several proposed pathways that this is happening. And some of you will understand the verbiage here. Complement activation on endothelial surfaces. Complement is a part of your immune system. And complement should not be activated unless there's a serious threat coming in from the outside world. But he says this complement is activated on the inner lining of blood vessels, including the anti-spike or the anti-PEG pathways. Antibody-dependent cellular cytotoxicity against cells presenting spike peptides. Direct liponanoparticle-driven innate immune signaling in endothelial stress, and microthrombi formation and glycocalyx injury across the microvasculature. And the microthrombi, of course, are the itty-bitty little tiny blood clots. So he argues these mechanisms acting together can explain the real-world signals that are seen in people who had received this so-called vaccination. And the outcomes are manifesting in the real world as surging reports. And I've talked about this endlessly on this show: cardiac inflammation, neurological events, microclotting, and sudden deaths. So several red flags have been escalating among those who receive the mRNA injections, including persistent signals in the sense of reports of spike fragments or vaccine RNA detected in blood or tissues weeks to months later after the last injection. And remember, it was only supposed to stay in the body for 3 or 4 days. And it was only supposed to stay at the injection site. Now, I have enough experience with this that when I first heard that, stay at the injection site, who are you kidding? Nothing stays at the injection site unless it's too big to get into the bloodstream. You may get a bullet in the arm. That's going to stay at the injection site until you take it out. Your body, if you can survive the infective process, will eventually work it to the surface and get rid of it. But when you have solutions with absolutely micro-sized content, it's going to get in the bloodstream and it's going to go for a ride like you are in a pontoon boat down the Snake River in June. Then there are platform effects, he says. Animal work suggesting lipid nanoparticles can provoke inflammation even without the spike payload, raising questions about what's due to the nanoparticles versus the encoded antigen. What does all that mean? It means the spike protein doesn't have to be present in order to provoke inflammation, just the presence of the lipid nanoparticle, which is what's in the injection that contains the mRNA. The lipid nano meaning very small, lipid meaning fat, so it's a very, very small fat particle. Why do they put this thing inside of fat? Be interesting to see how they do that. You know, it's like, well, maybe like making sausage, but still. Because your cells want fat. Your cells love fat. Your cell wall, I don't care what kind of tissue it is lined with fat receptors. So that fats in the blood, triglycerides or whatever else, can get inside the cell for energy production. So they take these things like Trojan horses, wrap them up in fat. And so what he's saying is they found out that the resulting inflammation that can lead to serious side effects can take place even without the spike protein being there. or the spike protein is such a lower level that it doesn't trigger an antigenic effect, which simply means the immune system is not responding to the presence of these spike proteins because they're so few. But the very presence of a liponanid particle can invoke inflammation because it doesn't belong there in the first place, and your immune system recognizes that. Then he talks about the overestimation risk. He says human evidence of serious adverse events is piling up, and poor separation of post-infection versus post-vaccination effects have masked the true risk. Now, this is not the first time, of course, that Bhakti has raised the alarm about these genetic shots. As Slay News was reporting last year, Bhakti testified that the COVID mRNA shots are life-threatening to humans. Who did he testify this to? Various legal bodies. And just recently, he warned about pushing these injections onto the public only benefits the infinitely evil global elites. So he issued this warning during testimony before lawmakers of the German parliament. He said this, after I get a drink. He said this is not, the vaccination turned out to be the greatest blessing for the money and world's elites, for the pharmaceutical industry and politics. They could pursue their own interests under the common slogan, everything for public health, everything for the well-being of the general public. To achieve this goal, they created the World Health Organization. These non-democratically elected people, basically a private association that is in the process of gaining power over the healthcare system in the 190 member states. Who hasn't heard about the mysterious sudden cardiac deaths occurring around the world? They're just the tip of the iceberg, he warned. Heart disease caused by vaccinations is on the agenda of young and old alike. Then, concluding his testimony before the German lawmakers, he said this: anyone who praises RNA vaccines are safe and effective, anyone who claims that vaccination rarely causes serious side effects, is either incredibly ignorant or infinitely evil, because they're committing a crime. Just like everyone who actively or passively pursues and supports this vaccination, because it is now scientifically proven that vaccination can only have negative effects, and this to a life-threatening extent. So he characterized all of this as a crime against humanity. He's loudly calling for the immediate halt to mRNA programs before the damage becomes irreversible. And then he said something kind of chilling. He, along with other experts, are saying it probably is already too late to do anything about it. Ugh. His last name is Bhakdi, Bhakdi. Sukharit, Sucharit, Bhakdi, Bhakdi. Recently, before the German parliament. So I thought you'd find that somewhat interesting. I haven't done a COVID update for some time, but they're still being pushed, and safe and effective. You don't have to. It's safe because there's no side effects to worry about, except only in the most extreme, unusually rare cases that they say, like other vaccines, the same thing. And it's effective in the sense that it will stop you from getting COVID. And what happens to you when you get COVID? You get a headache. You get upper respiratory congestion. All right. A couple of people say I sound muffled. They say I sound, is it possible to get closer to your mic? I think my mic is the computer mic. Let me see if I can do something different here. Hold on a second. I'm glad you asked. Maybe there is something I can do here. Let's go to the USB audio device. All right, now let's see if I still sound as muffled. I changed my microphone. I'm sorry that it's an hour and a half in the program, but I think the only way really around this is to start doing live shows in the studio. And if we had screening capability, phone screening, I would take calls. All right, now a little flashback. NBC News. This is 4 years ago. And NBC News did this short spread on, well, here's a comment. My wife woke up this morning with a UTI. She has had one in many years. Go to the office. I know who this is, who told me this. Go to the office and get a bottle of Cal Ammo. And in this bottle of Cal Ammo, she's going to take 6 of the pills right away, wash it down, and then about 4 hours later, take a couple of them every 3 or 4 hours that she's awake, and watch what happens. I guarantee you. Oh, that's better sound? Okay. Oh, good. I'm glad you told me. I just changed the mic. Now, had I any engineering in my head, I probably could have solved these things a long, long time ago. Anyway, this is a little flashback from NBC News 4 years ago. Majority of mumps cases are among the vaccinated, the CDC finds. So as many as 94% of children and adolescents who contracted the highly contagious virus have been vaccinated. NBC News, December 2021. I'm going to read that again. As many as 94% of children and adolescents who contracted the highly contagious virus have been vaccinated. Do you know anybody that died of mumps? I don't. I got mumps as a kid. I got chicken pox as a kid. I got measles as a kid. I think all that was over with before I was out of the first grade. I'm going to read that one more time, just so it sets in your head. As many as 94% of children and adolescents who contracted the highly contagious virus have been vaccinated. Now, why do they say highly contagious? Yeah, it is. But it wasn't highly deadly. I don't know anybody who had side effects from the mumps. Maybe there is somebody that, has 2 or 3 comorbidities. Some extremely sick child, perhaps. The average child? Jeez. The parotid gland swells up for a few days. And I think it's all a part of the initiation into becoming a well immunized living human being. The parotid gland does more than just make saliva. The parotid gland is sitting there on both sides of your mouth, in the back area of your cheek, watching what you eat, so that it can initiate various offsetting strategies to deal with what you're swallowing. And so it sits there and it says, oh, look at that. They're eating mackerel. This is wonderful. I'm going to initiate a certain digestive pathway, so as soon as the fat, the delicious, wonderful, health-restoring fat of that piece of mackerel gets into the system, the body will be able to utilize it immediately. and then sit there and goes, oh no, here comes some more of those super spicy flavored potato chips. Now, what am I supposed to do with that? And that's what the parotid gland does, trying to set up various digestive pathways, signaling down to the furnace area below on how to get the best amount of energy out of the food that's being fed. Now, it gets infected. How many adults do you know who've had mumps? In over 30 years of practice and over 23,000 patients, I have never run across one adult with mumps. It happens, but not in my office. I haven't seen it. Not that it doesn't occur. It does occur, but it is so rare. But I think it's a part of the immune system turning back on. And so a child will get a trigger from another child that has mumps, trigger in the sense of viruses, and then the uninfected, and I use the word infected only because that's what they're saying here. I don't think it's an infection. I think it's in complement that I mentioned earlier in relation to the COVID vaccine and the activation of complement upon the endothelial lining of arteries is leading to some of the serious side effects in microclotting, according to Dr. Bhakti. Well, complement is also released when you are experiencing a new antigen. An antigen is anything that triggers the immune system. Now, I'm reading from this report. Mumps cases continue to circulate in the U.S. largely among vaccinated people, including children. Now, this is not from the Children's Health Defense Network. This is from NBC News, Saturday, 4th of December, 2021. Cases of mumps, once a common childhood illness, declined by more than 99% in the U.S. after a vaccine against the highly contagious respiratory infection was developed in 1967. Cases dropped to just 231 in 2003, down from more than 152,000 in 1968. But cases began climbing again in 2006 when 6,584 were reported, most of them in vaccinated people. Uh-oh, how did this article slip through into the news? According to the report from the Center for Disease Control, 1/3 of mumps cases in the U.S. from 2007 to 2009 were reported in children and adolescents. As many as 94% of those who contracted the illness had been vaccinated. And I'm quoting directly here. Before that, large outbreaks of mumps among people who were fully vaccinated were not common, including among vaccinated children, said Marielle Marlowe, an epidemiologist at the CDC who led the new study. But the disease symptoms are usually milder and complications are less frequent in vaccinated people. But they're getting it. Experts aren't sure why vaccinated people get mumps, because the vaccine didn't work. But multiple factors appear to be affecting immunity in vaccinated people, including a lack of prior exposure to the virus and waning immunity and circulation of genotypes the vaccine doesn't contain. Oh, you mean the virus might mutate? The mumps virus is spread through direct contact with saliva or respiratory droplets from the mouth, the nose, or the throat of an infected person. An infected person can spread the virus by coughing, sneezing, talking, sharing drinks, or during close contact activities such as sports. Nearly 91% of U.S. population has had at least one dose of the 2-dose measles, mumps, and rubella, or MMR, which is administered between 12 months and 6 years and is 88% effective against the disease. Did you follow that? 94% of those with mumps were vaccinated, but the vaccine is 88% effective. Cases in recent years have largely been driven by big localized outbreaks, although a peak in 2016 In 2017 included more than 150 outbreaks reported in 37 states, amounting to 9,000 cases. I'm looking here to see how many of them died, but it's not in the report. Mumps cases decreased last year compared to the previous 6 years, but the illness continued to circulate in the U.S. despite distancing, lockdowns, and masking. From April 1, 2020 to the end of the year, 32 health departments reported 142 mumps cases. The numbers are still low, and they aren't a reason to believe vaccines are no longer effective. We're talking about an infection that almost every kid in America would get before they were 20, compared to the pre-vaccine era, where kids who got the MMR vaccine remained extremely protected against mumps. Oh, that's why the new vaccine doesn't work. All right. I'm not going to spend any more time on that. Now they're talking about a third dose. When the mumps vaccine became a vaccine by itself, so there would be one more that you can get. It was a 2-dose vaccine. Now they're talking about a third dose. Says that's one of the mysteries of understanding this is because when you give a genotype A vaccine during an outbreak, it still works. We've seen that during outbreaks on college campuses. A third dose of MMR is enough to stop it. I'm sorry if I'm sounding a little silly. I mean, maybe we could explain this in a simpler and more open way. Vaccines are dangerous, and they don't work in most cases. And the risk from these vaccines is much bigger than the risk from the virus they're trying to protect you from. Now, with proper nutrition and without all the environmental toxins we're running across, all the poisoned foods and poisoned water, the natural immunity is sufficient to fight the virus and attain lifelong immunity. Because I had it as a child, I do not expect to get mumps ever again in my so protected life. And if I'm sounding a little silly, I'm doing it on purpose. So, World Council of Health, this is another thing I want to cover really quick. World Council of Health is warning COVID shots a time bomb for mass death. The date of this article, August 17th, 2025. Experts point to lipid nanoparticles as biological grenades that could unleash a global wave of illness and fatalities. So, the World Council of Health has issued a very chilling red alert to the public to warn of a ticking time bomb of looming deaths, disease, and injuries among the billions of people who received the COVID mRNA vaccines. And this warning comes as global health bureaucrats and pharmaceutical giants continue to push the COVID mRNA shots. And so when I, listening to my morning news program in the Salt Lake area, mainly for weather, and a commercial will pop on, but the hosts themselves, the morning hosts, just as objectively and just as promotionally as they were, promoting a party that is going to celebrate all the work they've done as a newsreader on the morning news programs, coming out and talking about the effectiveness and how wonderful it is that we still have COVID vaccines available. Ugh. What's your price? What would they have to pay you to do this? If the CDC came to your neighborhood, now this isn't all that outrageous or impossible. Suppose the CDC came to your neighborhood or to your children's school and kind of did an internal survey of those who got the shot and those who didn't, or They came to your neighborhood and they found people who would look really good on TV, who had enough of the gift of gab that they could carry on a good 2 or 3 minute conversation with the newsreader that's there with them. And how much did they have to pay you to give a glowing report on how much better your life is now that you got the COVID vaccine? I'm serious. What is your price? Because you have one. I have one. It's extremely high. I mean, it is extremely high. And so it's kind of nonsense to even think about it because they're not going to pay me. I mean, who am I to start making some positive comments about the COVID vaccine and the wonderful changes that have occurred in the lives of my family and myself as a result of having lined up to get these shots. What would they have to pay you? $1,000, $10,000, $100,000? You know, I think it's a way to, even though it may seem like a silly question, I think it's a way to measure where you are in the spectrum. Because they would hit a price. Oh, no, they couldn't pay me enough. Oh, yeah? They sat there with a $1 million check made out to you, tax-free. You wouldn't get on there and say, well, yeah, we got the shot, and thank goodness we did because we didn't get COVID. Well, the World Council of Health, which is made up from representatives from many different nations now, have come out warning because the governments still continue, and the pharmaceutical giants, and the local health bureaucrats in our state, let alone the rest, continue to push these shots. And these new revelations about the chemical delivery system is now sending shockwaves through the scientific community. Now, I'm going to take a big leap here and compare this to the assassination of Charlie Kirk. And the story that first came out about Tyler Robinson being the shooter, he's no more the shooter than I was. But you don't hear too much about this anymore because the story is absolutely falling apart. And until they can find a way to cover up the egg on their face about this, the FBI and all the rest of them, you're not going to hear much more about this. It's going to, with all of the inconsistencies, you're not going to hear a whole lot more because they want you to forget about this. Well, I see the same thing here with this. Keep pushing the standard line. Keep pushing the standard line, even though those to whom you push the standard line know you're lying through your teeth. Eventually, you begin to be dulled by it. Then you get immune in the sense of your alarms don't go off anymore when you hear the BS. Now, originally, this was sold as a cutting-edge, safe, and effective technology, the LPN. And these LNPs, are now under scrutiny for potential long-term toxicity because it's not natural. But Dr. Jack, you said it's fat and the body wants fat. Yeah, it wants fat, but it's not a natural. Nature did not make the lipid nanoparticle. Nature makes lipid nanoparticles. It's part of the fat system in your body. But your nature did not make this form of a lipid nanoparticle. It's foreign, it's alien, but it looks right. And so it's easy to fool the cell. Now, despite all these concerns like long-term toxicity, metabolic disruption, triggering of autoimmune and neurodegenerative conditions, tremendous preponderance of heart disease, even after billions were injected with these unvetted nanotech, Pfizer and Moderna and government regulators are still stonewalling even basic safety questions. A patient asked me yesterday, I haven't seen in years, they started hurting again, and so they came back in and started asking me about vaccines, and they said, are you anti-vax? And I said, no, I'm not anti-vax. I am pro-vaccine safety study. And I said to her, are you aware that vaccines get in the marketplace without safety studies? She said, what are you talking about? I said, yeah, that's it. You're not going to see a new heart drug, a new brain drug, a new liver or kidney drug, a new cancer drug that hasn't gone through years of safety studies. How safe is this stuff really? Well, it's not very safe, but it's safer than his product over there. And so it gets into the marketplace. But at least something was done to stop some of the more dangerous drugs from getting into the marketplace. I said, but when it comes to vaccines, there are no safety studies. She didn't believe me. I said, if there were safety studies on vaccines, if there were safety studies out there right now on the COVID vaccine, it would be on the front page of every newspaper in America. But you won't see it because they're not there. Now, they claim they have them. They have in-house safety studies. Pfizer has safety studies. Moderna, AstraZeneca, J&J, they have their own safety studies. What I want are third-party safety studies who have nothing to gain except to be paid to do the study. They don't own stock. They don't sit on the board of directors. Their retirement portfolios do not carry a pharmaceutical company, which is hard to find anymore. Hard to find in the sense of a retirement program that doesn't carry it. And then have them do the study. And then to do the study, they have to have a control group, which is unethical. Why is it unethical? This was part of my debate with Dr. Paul Offit 20 years ago on K-Talk Radio. A control group, as you well know, is the group that didn't get the drug. So you have two basic groups. You may have more than two, but you've got to have two groups. The one that is getting the new drug or therapy or whatever else that's being tested, and a group that didn't get it. And then, that's the first blind. The second blind is that the people who are administering the drugs don't know who got the placebo and who got the real McCoy. And there's a statistician keeping track of all this stuff who knows who got what. But the people who are receiving it don't know, and the people who are administering it don't know. And then over here is a control group that were pre-checked ahead of time to make sure they didn't have any of the symptoms of what they're trying to test for. Well, the only way you can do that with a vaccine is you have to have a group in the control who do not get the vaccine. And that's considered unethical because everybody needs to have the vaccine. And so if you're going to do a study with kids, here's this group that doesn't get the vaccine. If it's a long-term study of, say, 20 years, this child's going to go without vaccines for 20 years. Now, I offer my son, Rourke, who's 25. 3 weeks from today, he's going to be 26. 6'5", as healthy as a horse, has never had one vaccine. Not one. Never gets sick. Yeah, he gets a little upper respiratory scratchiness now and then, but I think that's because of his food choices. Now, when you're doing these kinds of studies, the pharmaceutical companies like to brag about the safety studies that they've done. And this is Bobby Kennedy Jr.'s big contention in Health and Human Services. There aren't any safety studies. And then the vaccine companies come back and say, yeah, we do, here it is. And then you look at it, and it's like 2 weeks long. And nobody died in that 2-week period, so they're okay. That's not a safety study. Now, back to the LNPs, the lipid nanoparticle. Let me ask you a question. How many lipid nanoparticles, remember nano is because they are extremely small. How many liquid nanoparticles are in a single COVID vaccine dose? Now, before you grab Siri and ask Siri, well, let me ask Siri. I'll do that right here in front of you. Oh, I can't do Siri because I'm using the phone as a microphone. But you could. Say, hey Siri, how many liquid nanoparticles are in a single COVID vaccine dose? Now, when the eminent German researcher, Maria Gucci, tried to find out, she got a very disturbing response. Gucci had hit the mRNA vaccine maker Moderna with a Freedom of Information Act request. However, according to Gucci, Moderna's response was this: we don't know and it's irrelevant. When we now know, somebody in my office yesterday said, you're always laughing at the most inopportune times. And what do you mean? Well, when you should be screaming or throwing something or yelling or crying, you start laughing. Yeah, laughing is my psychic response to horrible information. I don't know where that comes from. It's probably developed as a child. But when I hear something shocking to my soul, I break out laughing. I guess that's what conditions me. I don't find what I just heard funny. I don't find it funny at all for 1 second that Moderna says, we don't know, we don't care. We don't know, and it's irrelevant. Then she presented the same question to the United Kingdom's drug regulator, the Medicines and Healthcare Products Regulatory Agency, but they didn't bother to answer her. And so this lack of transparency obviously has alarmed experts and watchdogs. And according to a report from the World Council of Health, quote, billions of people have been injected with a poorly characterized chemical delivery system, and now we're just starting to see the fallout. Remember when they started pushing these things in 2021, and some of the best experts in the world then said, give it 3 years, and you're going to start seeing a lot of die-off. Well, that would have been 2024, last year. And remember everything that was happening last year with the heart. All the myocarditis, the pericarditis, sudden deaths, people at podiums talking and falling dead right in front of everybody. There was a sports figure here that I think was women's soccer. Last week, was it, or the week before? Fell dead on the pitch. That doesn't usually happen to people who are in the kind of condition, physical condition you have to be a professional soccer player. German researcher Genevieve Berger reports that only one scientific paper includes mass and numerical data of the LNPs. The study that was detected in Moderna's SM102, which is a ionosable lipid, lingering in the bloodstream 7 days post-injection, still above background levels. And keep in mind, this is a synthetic, non-human lipid, as I said earlier. But because it's a lipid, the cell sees it as a lipid and takes it inside the cell, which was the prescribed delivery system in the first place. And then when it got in the cell, the lipid would be dissolved by enzymes, and the viral component would be present, which would trigger the production of spike proteins on the surface of the cell. And then the immune system would see these spike proteins and build the appropriate antibody, and now you would be protected against COVID infection. That's the theory. Well, now they're finding out what's inside that lipid particle, SM40, that's been around since the earliest polio shots, knowing to cause a cancer, accelerator, I think, a cancer accelerator, SM40, and other things that are in there. And you know the whole list. And so Berger, explaining this to the German government, comparing it to background levels, is like saying a trace of arsenic in your coffee is just fine. Don't worry about it. It's just a trace. Don't worry about it. So meanwhile, Pfizer's proprietary lipid, the ALC0315, has its own set of issues. Fresh vials, they're out there, showed a 0.19% of oxidized impurities, and the most reactive components weren't even fully tested. And oxidized lipids, these are considered to be biological grenades. I'm not going to get into the deep chemical reasons as to why. It just take too long to explain it. A landmark scientific review called The Chemical Reactivity of Membrane Lipids said this: when primary amines are present in membranes, reactive aldehydes can cross-link them, triggering vesicle aggregation. Vesicle are just little tiny blisters. In layman's terms, these particles don't just deliver mRNA, they can wreak havoc on the cell membrane. From cholesterol ratios that accelerate lipid breakdown in tertiary amines that interfere with cellular receptors, the evidence suggests that slow systemic toxicity from these particles may be flying completely under the radar. Which brings you to the unanswered question. Were some batches more toxic than others? Remember that when the batch numbers came out and everybody scrambled to look and see how many adverse effects were reported to that batch? Well, with no batch consistency data released, you're never going to know. And so what's necessary is transparency from both the vaccine manufacturers and the drug regulators, which means batch testing and liquid nanoparticle quantification and oxidation monitoring, and most critically, the long-term follow-up to understand how long these synthetic particles linger and what damage they might cause. And as the World Council of Health continues to push for the withdrawal of these experimental gene therapies, the silence from big pharma and public health agencies is deafening and deeply troubling. And I have not taken the time to call the Utah Board of Health or the Salt Lake County Health Board and ask them, why do you continue to push these drugs? You see what Bobby Kennedy Jr. is doing. He's trying to get them. They've already been removed now, thank goodness, from the childhood vaccine schedule. Now he's trying to get them removed from all vaccine schedules and leave it up to you. You can choose for yourself. He's not getting rid of it. I have mixed feelings about that. You know, when the H1N1 vaccine came out in 1974, and we had that picture of Gerald Ford dropping his pants to show his butt on public TV and getting the shot into his butt. After 25 people had died, they banned the vaccine. They took it off the market. 25 people. Now there are billions, according to Dr. Bhakti, who stand in line for the worst, the absolute worst of these possibilities. All right, now I was going to go into a little more about Tylenol and autism, and I don't think I want to do that. It would take too long to get into that. A key thing that I have tried to highlight in all of my health shows, ever since the very beginning, back in 1995, has been keeping up with one medical catastrophe after another. Because those responsible are never held accountable. You see anything happen with Fauci yet? Or Birx? See any committee investigations? The only thing I've heard is that there may be some controversy as to whether President Biden could pardon certain people for crimes that they had not been accused of. Is that what's holding it up? These people who are responsible for so many deaths and so many ongoing sick people who will be sick the rest of their lives have never been held responsible. And so by understanding that has happened in the past, you can see and understand what's happening now and what will likely happen in the future. And because vaccines, the medical profession says, yeah, they're risky, but they're necessary. And the government again and again concludes that they needed to tell the public all vaccines are safe and effective, as the potential injuries that a mass vaccination campaign would cause simply outweighed by the necessary benefit the vaccines can offer, which is the standard argument over and over and over again. And examples can be found again and again of severe injuries being systematically covered up for the greater good. And the earliest examples that we have of this is back in the 1870s with the smallpox vaccine, where people were dying en masse. But the argument was it's better for these few people to die than the many thousands of more who would die if we didn't give them the vaccine. And for some reason, we kind of default into believing that. You know, there's something about vaccines, the promise of this simple injection being sufficient to safely and effectively end all diseases. Obviously, it appeals to our ignorant mind, our unknowing mind. I don't mean ignorant in a judgmental sense. I mean that we don't have the knowledge. A lot of people don't. A lot of people don't bother studying. And so it appeals to the minds of government officials. Well, here's how we can really take care of the people, make sure they all get vaccines. And the promise is often a lie, so over and over that the unsafe, ineffective vaccines enter the market. And when this happens, then the officials who are invested in them do everything they can to protect the vaccine from scrutiny. And they simply cover up each red flag that emerges, and the medical field has dutifully complied with it. So, am I pro-vax or anti-vax? I am pro-safety. Show me the safety studies that I believe haven't been compromised by monetary reasons, and maybe I'll look at it closer. But in the meantime, not as for me in my house, I will pass on this one, thank you. All right, it looks like we're done. I hope the stream came through this time, especially with the UTIs and the interstitial cystitis. Again, all of those things, thank you. Coming clear on YouTube. Thank you very much. All those supplements I told you about, available at forbiddendoctor.com if you have ongoing problems with cystitis or interstitial cystitis. Also, the cow ammo, at the first sign of an itch or a burn, you take that cow ammo and watch what happens. As I said, that's why I know over 200 women who carry a little bottle of cow ammo in their bag. All right, I'm going to end it here at K-Talk, and then I will save the thing, and then we need to get something playing here. Paul, if you're listening, no, you're not listening. I'm trying to find. All right, I'm going to end the stream, obviously. To the streamers, thank you so much. Like and share and all that kind of stuff if you can do that. We're over 800 now subscribers. Over 800 subscribers on the YouTube program. We'd love to see that hit 1,000 by Christmas. And I will say, I'll bid you a fond adieu, and I will be back again Monday with catching up on what's going on around the planet. If you will email the office, jackstockwelloffice@gmail.com, for topics you would like me to talk about on the program, that's where you would do it, jackstockwelloffice@gmail.com, and I will try to address your interest or your requests. So I'm going to end the stream, even though it'll probably say, oh, it's the political one. Oh boy.